do the sex. Today's Locker Room Talk and Shots topic is From Cougar to Cub Whisper. Sex with women over 40, 50, 60, and beyond. And my special guest for today is Dr. Karen Toohey, an OBGYN at the Rodeo Drive Women's Health Center, serving the Beverly Hills, California area. And I am going to give her a moment to introduce herself to you in just a second. First, I want to give a shout out to Linda. Linda is a dedicated listener who is also a subscriber to my Triple X podcast, which is published every Thursday. And it is a podcast that, we get dirty. We go into depth, detail about the things going on in my personal life, which has been pretty crazy lately. We really dig into these sex topics in a, Triple X way. But also, Linda follows me on TikTok, and she reached out to me and asked me to cover the topic of what sex is like for women in their 50s, 60s, and beyond. Now, I added 40s into the intro because, I'm still in my 40s. So obviously my questions are going to be included in this podcast. But hey, Linda, thank you so much. I appreciate your support and your messages. It is listeners like you that keep me going. So listeners, if you have questions about sex, anything having to do with sex that you want answers to, more information on, some personal stories about, you got to email me, you got to reach out, and I will try and find you the expert or the person or the answers that you need. So, Dr. Karen, can I call you Dr. Karen?
Yeah, sure.
Can you tell my listeners a little bit about yourself?
Sure. So my name is Dr. Karen Toohey. I'm an OBGYN, originally from LA, California. I trained on the East Coast, so I got a little bit of snow. But anyway, now back in sunny California in Beverly Hills. I've been in practice for about 9 years, and I have a really big passion of just helping women feel comfortable with their own bodies, helping women feel comfortable having sex, and helping women have education about how to have the best sex that they can. So I'm happy to answer any questions. And today, really, the topic is sex in the 40s, 50s, 60s, and beyond. And there's so much. People, one of the first questions I ask women when they come into the office, I get a whole history. I ask, are you sexually active? And women in their 50s, 60s, 70s, 90s. I had one woman who's 91 years old, totally with it, still having sex with herself. But why not? And
yay!
Sometimes I've learned to never really have an expectation, because women are still sexually active well beyond menopause. And there are so many different ways to continue being sexually active and making it enjoyable and continuing the desire.
I love that. And so before we've even gotten into it, she has answered, I think, one of the biggest questions people have is like, how long do women keep having sex? So we're going to dig into that. We are both, I'm hydrating, midday podcast. I'm going to go to the gym after this. And we're sharing water. What are you doing?
Yeah, water.
Water.
This is water.
Yeah.
All right.
Getting crazy with Dr. Karen. All right. Cheers. Let's talk about
Cheers.
sex. All right. So we already have one of the biggest questions answered, which is, are women in their 50s, 60s, and beyond having sex? And apparently even into their 90s, at least sex with themselves. I assume in your 90s, you can still have sex with other people.
You can.
If you can find.
Absolutely. Yeah, you can. You just need a partner. And I will say, we'll get through, we'll cover this in detail, but as women age, we lose estrogen. So our ovaries stop working. We lose estrogen, we lose testosterone. And those are two huge hormones in keeping our sexual organs alive and well and moist, and keeping the tissue plump and healthy. And so, yes, absolutely, people can continue to have sex, but to have enjoyable sex, there are some things you can do to keep that alive and to keep the tissue healthy. So, absolutely.
Okay. That's good to know. So yeah, I would say one of I have questions that were sent, but and one of the first ones that was asked is it still pleasurable?
Absolutely. Absolutely can be. No reason why not. Many women have pain with intercourse after menopause, and that's just, again, because the tissue just becomes thin and dry and tears easily. If, some women, and so, really the trick is to keep that area full of estrogen. So you can either use an estrogen cream, like as a weekly maintenance. There are CO2 lasers that you can use in and around the vagina to really increase the collagen in the tissue, decrease laxity, increase lubrication. And so definitely you just can't do nothing. It's kind of like exercise. If you stop exercising, you will lose functionality. And so really the tissue in and around the vagina needs to be estrogenized. It needs estrogen, either topical estrogen, or if you're taking a hormone replacement therapy, like either by a patch or a cream or a pill, or a pellet. Definitely the tissue in and around the vagina responds to estrogen. So to keep it healthy, you need to do some sort of estrogen maintenance or a CO2 fractionated laser.
Can you talk about the laser? I don't know that I've heard of this before, so let's talk specifically about the laser.
Oh yeah, absolutely.
What is it?
So, so the one that we personally have in our office is called a Mona Lisa, and a Mona Lisa essentially is a CO2 laser that you put in a probe into the vagina. And what it does is it creates micro perforations in the tissue. It creates like damage in the tissue, so to say, and it allows everything to be, it increases the collagen production and increases the healing in and around the vagina. So then you would do it in the inside of the vagina and on the vulva. And it really helps repair the tissue and makes it similar to what it was prior to menopause. And the CO2 laser is not the only thing that does this. It can be used in conjunction with Cliovana, which is also a sound wave machine that will do this very similar things. But the sound wave machine specifically targets like the nerves in and around the vagina to help increase your orgasms, help increase the frequency of orgasms, the intensity of the orgasms. You can also do PRP injections in and around the vagina. PRP is platelet-rich plasma. And so what that is they draw your blood, spin it down, and remove the platelets from that. The platelets have lots and lots of growth factors. So you can imagine if you get a cut on your finger, you'll have like a little clot there, and that clot will help repair your skin, help repair this cut so that it heals. And that's essentially what we're doing is we're removing these growth factors from your body, from your blood, sticking them back into the vagina. So this will help with incontinence. It'll help with laxity. It'll help with like moisture, to really help the tissue in the vagina stay healthy, and help you continue to have a really, really healthy sex life.
Okay, guys, I hope you're taking notes because this is all except for now Cliovana. I think in a past podcast I had heard about. I have not heard about the other two treatments. That's new news to me. The Mona Lisa makes sense to me. I think most women have looked into things like laser treatment on your skin, on your face.
It is the same.
Right.
It is the same. People get lasers on their face to help keep their face youthful. Same for the vagina. And the vagina, sex is huge. Sex is a really big part of your life, helps with relationships. But besides for that, it'll help with incontinence. It'll help with dryness, itchiness. You shouldn't have to think about your vagina every day. If you're thinking about your vagina because it's bothering you, because it's itchy, because it's too dry, because you can't even think about having sex, then that is a problem. That needs to be fixed and can be
Right.
fixed.
Yeah, yeah. And I think I like the comparison between the care we put into our face and our skin on our upper body. But then when it comes to our vulva and our pussy, no one thinks about it. And it is some of the most delicate and important skin on our body. And so it makes sense that similar treatments. Now, just to recap for listeners, it sounds like the Mona Lisa is more about rejuvenating the skin on your vulva and then in your vagina. Now, I do know that I've read about, and I have nightmares now about vaginal atrophy. It sounds like that's what you're talking about. It's kind of a use it or lose it thing. When the skin is just left kind of age and isn't used, it starts to atrophy. And this battles that. It makes sense to me. Cliavana, as I understand it, is more about for women who lose their libido or are having a hard time experiencing pleasure, coming to orgasm. It helps with pleasure and orgasm, correct?
Cliovana will help with orgasm. It'll help with the intensity of your orgasm, but it does also help a little bit with incontinence because as we age, we lose the nerve function to hold in our urine, or so all of these nerves kind of work together in and around the vagina. Many women experience a really intense orgasm if they're doing a Kegel exercise and those muscles are really just like holding in their urine, holding in their farts. All of those muscles, just holding it all in, really can intensify the orgasm. And so all of this works together.
How about holding in the farts that aren't even coming yet, but you just don't want them to because you don't want to fart on your partner, especially the new ones, the new partners, the old partners, they just have to take what they get. New partners,
Yeah. So there's one thing about, sex in your after menopause is that you lose the estrogen, the tissue can become frail and just really, it tears easily and dry. But then on the other side, there are people who have, and the vagina just becomes very, very small, especially if you don't use the vagina. You can't stick anything in there after a while. It becomes difficult.
Wait, we need to stop.
Yeah.
Let me just have a moment. All right. So you're saying it really is use it or lose it. That if you stop, and I'm assuming this means kind of mostly penetration, right? Like you need to have penetrative sex with yourself or something like that. Or I didn't realize it can literally kind of close up and be usable.
Yeah. Absolutely. It becomes super, super small. So women that are not sexually active come in for their pap smears. And it's really hard to get in there. And they're in a lot of pain. I can barely see anything. Everything is atrophied. And so that happens for two reasons. Number one, the lack of estrogen and the lack of intercourse. So women who continue to have intercourse, even if it doesn't feel good and it feels really miserable and they're just doing it for their partners, their vagina stays open. There are so many things we can do to make it feel pleasurable and continue to stay open, but their vagina will stay open. So those are two scenarios. You just have lack of estrogen, but it's just not feeling good. The other scenario is that, women that, are past menopause or women that have had babies, lots of babies vaginally, sometimes the vagina is kind of just really big and things are falling out. The bladder is falling out. The rectum can fall out. The uterus can fall out. There are so many, so the vagina is just really big and they're not really achieving pleasure because of just because everything is so loose and lax. And so then that's another thing. So they still need the estrogen to keep the tissue healthy. But there are some procedures you can do, like a vaginoplasty, to kind of just tighten things up and make things feel good.
Right. And it's funny when people talk about that, the vaginal vaginoplasty, right?
Yeah.
It's often talked about as a vanity thing, but I
Yeah.
no. So can you clarify that?
Yeah. So the angle of the vagina is really, really important. So imagine your vagina is kind of like a tube. The tube is at this downward angle. So if I were, I don't know, this makeshift tube here, the tube is at a downward angle. And the penis usually will hit like this top part of the vagina. So that's where your G spot is. That's where all of your, a lot of the nerves are, that make people feel lots of pleasure. And as we age, the vagina, just like the rest of the skin in our body, kind of sags. And this tube, instead of having this like downward angle, now has this more of a straight angle. So as like the penis comes in, it's just not really hitting the top part of the vagina anymore. And so people can sometimes just feel nothing. And this doesn't just happen in menopause. This can happen postpartum, and in all those years. And so sex just doesn't feel the same anymore. And it's not only because the vagina is just more lax, it's also just because the angle is different. And so doing a vaginoplasty will really change the angle of the vagina. So you'll notice that in some positions, sex just feels so much better. And that's because the penis is hitting a different spot. And so really different nerve bundles are being pleasured in that area. And so, yeah, different positions feel better.
So it's not about how your pussy looks, it's about how it feels, folks. We can do these things to make ourselves feel better. I think this is really interesting to me, and I'm going to tell you why. And I've talked about it on this podcast a lot. When I was younger, in my early 20s, well, when I started having sex, which was in my teens, up to having my third child, I had 3 children, I did not understand the pleasure of penetration. I didn't feel anything, sometimes discomfort. After my third child, I started having sex and all of a sudden I was like, oh my God, I feel something. And so I'm wondering if because I was so small at the time, like it changed that angle. And now in the last, I don't know, a couple of years, I've totally discovered my G-spot and I can access it during sex, which I've never been able to do before. So learning about the angle kind of makes sense to me because something has shifted. Thank you, God. I just don't want it to shift out of that. Like, let's stay in that position.
Yeah.
So that's fascinating to me. I did not know that. One thing I do want to ask you about is I have read that using a toy, like I have a pulsator, which is something I've never tried until this year, for internal vaginal friction. Is that something that regularly using that would help with the elasticity and health of the vagina?
So it will, just having sex using will increase the blood flow to the vagina, and just having blood flow in this area will improve your sexual satisfaction in general, will improve the health to the tissue of the vagina. So yeah, using a vibrator definitely increases pleasure to the vagina, increases health and vitality to the vagina. You know, it's really funny. My sister-in-law, Dr. Alexandra Dubinskaya, she is a urogynecologist and a pelvic floor reconstruction surgeon. And she actually just put out a study that showed that using a vibrator is just what the doctor ordered. Definitely helps with blood flow in and around the tissues of the vagina, and very, very helpful to help keeping things healthy.
I love that you say that because so a little bit about me, because I know that you don't know, in 2022, I did 365 days of orgasms. I had an orgasm, at least one, every day. It was really difficult. But during that time, I also tested out a slew of sex toys. And during that time, of course, I did a lot of reading and talking to people and learned that the medical community it sounds like starting to look at how do they prescribe some of these, I like to call them sex tools or women's sexuality tools, instruments that do help, with the health of your vagina. I know for a fact that if women after postmenopausal women are in need of an excuse to have sex, which we're going to get to that, orgasms themselves are so good for our health, right?
Absolutely. Yeah.
I mean,
In so
sex
many
is.
ways.
People don't realize
Yeah.
that sex is actually really good for women's health. Now, I know, my apologies to Mr. Tui, but men can be real dicks, and sometimes we don't want to fuck them. We don't want to mess with that after 50. But orgasms can be had with many different objects and people of the same sex. So, sex is healthy.
Healthy, helps decrease stress. Stress is really, really, really underrated in terms of how bad it is for our health. It increases our blood pressure, increases risk for cancer, increases all sorts of issues in our body, skin disorders. Really, stress is so bad, and orgasms really help decrease stress. And so that decreasing your blood pressure, really super important to take a minute and take care of yourself.
Yeah. Don't take my word for it. We've got a doctor on board. I'm championing sex. So, I guess what I want to get into now is, do you find, I know that women in their 40s and maybe early 50s worry a lot about losing their libido. Is that inevitable? They worry because I know in our 40s, a lot of us hit our prime, meaning I know for myself, like my libido shot up, and not only that, my brain was like, I want to do all the weird sex shit. Like I just was like next level, like ready to do it all. And I know a lot of women are afraid of losing their libido, losing their, their sexuality and feeling seductive. Is that inevitable?
No. So if you do nothing, it is it can be inevitable. Women, I think something very unique about us is that sex really starts in our brain, and that there are a lot of things we can do to get in the mood based on how we think, what we read, where we want to put that energy. But not just that, like just physiologically, our ovaries not just make estrogen, they also make testosterone. So we lose testosterone. By the time you're 40, you've lost half of the testosterone that you made in your 20s. And that's actually really important because we think of testosterone as like the male hormone, but actually women have a lot of testosterone too. And as we age, it's actually really important to supplement that. And women who have issues with libido find that it's really helped and taken care of if they are supplemented with testosterone. And so really, either in a pellet or a cream, and testosterone has been shown to not only help with libido, helps with getting into the mood in general. It gives you more energy, helps people stay fit. These men, they like exercise for 5 minutes and they like go think about going on a diet and they've already like become fit. I mean, it's a real thing. So testosterone is really helpful in general for all of our health. Helps with like protect our bones, decrease your risk of breast cancer. And so, it's not inevitable, but you need to put energy into maintaining a healthy sex life after menopause. But that's just life. You need to put energy in maintaining your physical fitness after menopause and just staying healthy in general.
Right. And so you can go to a doctor. So someone could come to a doctor like you and be checked to, see if they need estrogen or testosterone and to get that kind of support.
Yeah, absolutely. It's interesting because I would say 50 years ago, I don't think OBGYNs were prescribing testosterone to women. And now it is more common. And, it's very telling, actually. In Europe, there's a testosterone dose that you can pick up at any pharmacy, a dose just for women. Here in the United States, there isn't such a dose. So you can pick up testosterone at a dose for men at the pharmacy, but the FDA hasn't approved such a dose for women yet. But you can go to a compounding pharmacy and your doctor can just prescribe you a dose. And I probably prescribe like testosterone 6 or 7 times a day or a week. A week. And
Right.
women are they feel good. They feel energized. They feel like themselves again, because you lose these hormones. And if you want to feel, you just need supplementation, and people feel good.
So I am in perimenopause right now and dealing with that. And I have been pretty mortified. I'm going to be honest with you. The doctors I've gone to, and I've really had to just advocate for myself. I am shocked at how many doctors and how just don't seem to have answers, even when they are OBGYNs. I'm like, how come am I finding out more through these interviews with doctors on my podcast? I have learned more through my podcast than going into my doctor.
Yeah. In training, we weren't really trained really well on this. I think there are huge disservice studies that have been done that have just really were not good studies. And kind of like ruined it for women, and women's health is not at the forefront of like where everyone's mind is. Viagra got approved fairly quickly, was available very, very quickly. But there are things for women that are just underutilized, understudied. The training is there if you look for it, but it's not the general training that, you'll get at the run-of-the-mill OBGYN residency. And it's really unfortunate, but those doctors exist. There are people out there that care about sexual health, and you'll find them.
Right.
Yeah.
I think that also for women, sex itself has been such a shameful thing in our society, to want it, to desire it, to want to do it a lot, to want to do it with different people and in different ways. Once menopause hits, people assume you shouldn't be having sex anymore. It's the first thing when someone wants to attack me, my show, the content I make, the first thing they do is they go after my age. It's like, why would this old woman, and then I'm like, I'm a woman who's having lots of sex. And I think women my age and older are doing that. I have read a study where actually menopause, they find that women after menopause have more interest in sex because they aren't having their period,
Right. You're not worried about getting pregnant.
Right. And kind of that period of our life where everyone is waiting for us to have children and, doing the whole Mother Mary Magdalene shit to us falls away. And now it's like, oh, I can go have sex with whomever I want, whenever I want. No one's looking at me anymore as, when are you going to find a man? When are you going to settle down? When are you going to have kids? And so I know at least women in their 50s, I have to assume that this is also older women are interested in sex and are having some crazy good sex.
Yeah. There was actually nursing homes have like a resurgence of chlamydia, like because they're having sex, and it's just, they're enjoying it. Why not?
That was one of the questions actually that was sent to me. What about the stories that everyone's been hearing about the STDs in nursing homes? And someone was like, can you still get STDs? So I'm going to pose that question to you. I think it's pretty obvious, but.
Yeah, absolutely. You can definitely still get an STD. Gonorrhea, chlamydia, syphilis is getting a comeback. HIV, herpes, HPV, all can get that through sex. You can't get pregnant after menopause, which is huge relief, right? But definitely still need to use a condom to just have safe sex. Yeah.
I guess in the nursing home, you're like, whatever, a little herpes. I've only got 10, 20 years left. I don't-
Yeah.
um, yeah, so that was funny. That's a question that has actually come up. And I do think that that is proof itself that older women are having a lot of good sex now. Another question that came up is, will I still have the energy?
That really depends, right? Um, I think that people who continue to exercise, I think moving from when, as soon as you're thinking about it, right now is like the time you should, if you're not already having an exercise routine, you should make one and hold yourself to it, because exercise really is the key to continue having energy later. All of the people who are still, I call them walkie talkies, people that are like moving and hopping on the table, really with like excellent agility, they are exercising, they're moving, they're not sitting on the couch knitting, they are just really moving on the go, swimming, exercising, hiking. They're not sitting idle.
Lack of movement. If you stay down, you will literally stay down. And not
Yeah.
this isn't, we're not talking about going down. This is not in the good way, folks, not in the
Yeah.
desired way. And I suppose as far as the kind of sex people are having at that age, it depends on their interest. I guess what I feel like this comes down to is I'm 48. When I was growing up, someone who was 48 looked like somebody who's 70 now. It looks different. Age looks different now because we have different ways of taking care of ourselves. Nutrition is better. We know how to drag out the healthy, vibrant part of our life. And I think still in my mind, when I hear ages like 60, 70, 80, fear and the idea of being elderly pops into my mind, which is ironic because my partner, my male partner, is 58 and has the body of a ripped 35-year-old, because that has been his focus is longevity and being healthy and vibrant. He's a surfer and wants to surf until he's 80. So he wants to surf until he's 80. I want to ride his surfboard until I'm 80. So I go to the gym now too.
Yeah. Yeah. It's really important for everyone. And that's really the key. Yeah.
So if you were to say, here are the top, I'm going to say 3 to 5 things, and we're going to list them, things that women should do after 50 if they want to continue banging until they're 90 or 100, should they live that long. What would be the things that you would list off?
So, number one, an exercise routine, just staying healthy. Number two, keeping the tissue in and around the vagina super healthy. So making sure that you're using vaginal estrogen and testosterone, or that you're using like a vaginal laser. So it's a treatment once a year. So you do the first treatment is every 6 weeks, three different treatments, and then once a year for maintenance. So you're doing some sort of like laser treatment to keep the tissue healthy. And like a hormone therapy, and having a good relationship with yourself, I think those are the 3 things to keep it coming.
I like that. That was a little pun right there. I got that. So we do need to talk about this hormone therapy. Whenever I talk about, I'm on a low dose 1 milligram of estrogen, and it's worked oral. The patches did not work for me because I was so active. I was sweating them off, and had me all over the place. But when I bring up the fact that I'm on estrogen, the women around me kind of gasp and they're a little afraid. They've heard that, if you take estrogen, you're going to get cancer, you're going to get breast cancer. They are terrified of estrogen, and they are terrified of the idea of hormone replacement therapy in whatever form, because they've heard, and they're still hearing from their doctors that it is dangerous and that there is a lot of just grin and bear it, get through menopause. If you want to keep having sex, just throw lube on it. That is the advice they are being given, and they are miserable. Women are miserable to the
Yeah, that sounds
point of,
terrible.
to the point of it's affecting their mental health. I know that before I got on estrogen, I was depressed, anxious, agitated. I couldn't sleep. It was unbearable. So can you speak to the safety of hormone replacement therapy?
Yeah. So I would say 25 years ago, there was a study that came out, the Women's Health Initiative study. And that had they were testing the safety of hormone therapy, estrogen in particular, on women, and they looked at the safety. And that study came to an abrupt halt, and they said, this is not safe. We have to stop it. However, that was a huge disservice, I think, to women, because if you actually look at the study and look at what they were doing and look at the outcomes, that is not a very good study. And, you know, hundreds of thousands of women over the last 20 years have really had that misfortune of not having the benefit of estrogen to protect their bones, to protect their brains, to protect their hearts, to protect their libidos, their life.
Yeah. I want to stop you there because I want us to recap that. I want all of the listeners to listen to why estrogen actually is a healthy thing for you to take at this point in your life. Again, it protects what?
So it protects your bones, it protects your brain, it protects your heart. Studies have shown that it doesn't actually cause breast cancer. And there are risks. I wouldn't start it if you're already past 10 years after menopause, but if you're right at the beginning of menopause, perimenopause, in your first 5 years after menopause, that is the ideal time to start it. And, there are nuances. Not everyone is a perfect candidate, but I would say the majority of people can be. And if you're a healthy person without significant medical problems and you're in your first, 5 years after menopause or right before menopause, when you're really feeling those symptoms of, the up and down flow of your estrogen levels, then that is really the ideal time to start an estrogen therapy. And you'll have so many benefits for the rest of your life. Women who are on hormone therapy are actually shown to live longer, and not just live longer, but have healthier lives while they're living, which is really the key. Because if you're living in a nursing home and not moving for an extra 10 years, that doesn't do anyone any good.
No. And it also protects your libido, correct?
Yeah. So it protects your libido. Absolutely. And it's not just estrogen. I think if you have a uterus, you need progesterone to protect you from endometrial cancer. So you need estrogen, progesterone if you have a uterus, and testosterone.
Mm-hmm. Yeah. Mm-hmm. And so you can go to your doctor and talk to them about testosterone.
Yeah, absolutely.
So,
yeah, okay. I really give it to very many people for in a cream form and pellet forms. It is definitely option to get it.
Okay.
Yeah.
That's great. Yeah. Well, I hope Linda and all of my other listeners out there are hearing that, your 50s are not the end of your sex life. I know, certainly I am turning, at the end of this month, I keep saying 48, but I will be 49 in a month. And
Happy birthday.
Thank you. I don't see my sex life anywhere close to ending. In fact, I would say I am more sexual than I have ever been, more sexually active, more sexually experimental. And it's interesting to me as I go out and I do sort of sexually adventurous things, I go to the sex club or I get invited to all sorts of things. I find that the vast majority of people who are there and having fun and being sexy are 40 and above. It's, it's like, I know I'm also in a bubble in Portland, but I do find that most of the people are older. And I think it's partially because, we aren't worried about having kids or worried about our kids anymore. We're just being adults. But that also, I think, speaks to sexual health and vitality in this latter part, middle age and beyond.
Yeah, absolutely. there's a sexual renaissance. I think absolutely. People definitely don't want to be demure and old and just in their houses anymore. People want to live and continue living and have a full life.
I like that, a sexual renaissance. Hey, you heard it from the doctor. Not just
Yeah.
me, some horny woman, from a doctor. A sexual renaissance. I do think that is what it is. And I also have been talking to friends lately about how I think that the concept of getting old is a social construct. We've been told after 40, you go to bed early. Here is what your life should look like. And that is someone feeding that to us. I think aging is a reality. The aging body and what you have to do to keep it healthy and active and vibrant, that's a reality. But getting old is a choice.
Yeah,
To,
absolutely.
I think, a huge extent. I stay up late. I still party till 3 a.m. with my friends, and I adult like I'm doing right now. So, is there anything else you want to add for listeners who are just really afraid or curious or, wanting to enjoy their midlife to their older years in a vibrant sexual way?
Yeah, I would say talk to your doctor. Your doctor has lots of things up their sleeve. Um, Many times in like this classic visit when you come in for your annual, there isn't enough time to talk about everything. And so, it's easier to just not ask questions, but make a visit to come in that's not your annual, where you're not getting your pap smear, where you're only coming to talk about your sex life. And those are honestly my funnest visits because people, people really grow from those visits. They have real help. They can become sexually satisfied, and they get real results. So come to your doctor. Don't be afraid to ask questions. Ask them how you can have excellent orgasms. Ask them how you can continue having a healthy tissue in and around the vagina. Just ask lots of questions. Be your own best advocate.
Absolutely. I love that. And so this is exactly how we are. Women in their 40s and 50s and 60s are going from being cougars. I was a cougar for a while, but now I realize, no, I was really a cub whisperer. And younger men are having sex with older women more. And this is, I think, why we're going to talk about it as being part of the sexual renaissance that women 50 and above are going through. I love that.
Absolutely.
That just made my day. You made my day with that. Can
Ah.
you tell my listeners where they can look up your information and find out more about you?
Yeah, sure. So my name is Karen Tooby. I'm an OBGYN board certified. And my office is on Rodeo Drive in Beverly Hills. So you can find my website, www.rodeodrivewomenshealthcenter.com or rdwhc.com. And we can do telephone visits. So we have, thank you, COVID, for that. So
Can just to interrupt, can people who aren't in California? Okay, so you can serve anybody anywhere.
yeah, so we can definitely do a telehealth visit. You create an appointment. We can be on a Zoom type of encounter. You can ask your questions, and I'm happy to give you personal advice. Yeah, yeah,
Okay, you guys, you heard it. You now even know who to go to, and you know that she will be an advocate and listen and hook you up. So you got what you need if you want to be banging until you're 91, 2, 3, and beyond. You got your person.
yeah.
So y'all know where to find me. Locker Room Talking Shots on Instagram, Facebook. She Explores Life, Instagram, Facebook. Join me on TikTok, Locker Room Talk Shot. No, I'm sorry, that's wrong. Locker Room Talk and Shots podcast. Please check out my Triple X podcast, which is published every Thursday, and it is not a dull moment. If you want to find out more about Dr. Karen Tooby, you're going to scroll down to the notes in this podcast, and you're going to find all the links that you need there. And I want to thank you again so much for this. Was enlightening. I again learned so much from the conversation. So
Thank you for having me. Thank you very much.
yeah, absolutely. Until next time, listeners, I will see you in the locker room. Cheers.